Story number 1, Release Form. I arrived at the Regional Mental Health Hospital in upstate New York on a Tuesday morning in late September to conduct standard release evaluations for 3 patients scheduled for discharge that week. The assignment was routine. I had completed similar evaluations at 7 different facilities over the previous 4 years, and the process was familiar enough that I could move through it without requiring much guidance from the local staff. The first 2 evaluations proceeded normally. Both patients were coherent, their discharge plans were documented, and there were no complications with their paperwork. I completed the assessments by midday and was scheduled to interview the 3rd patient, Claire Hendricks, at 2 o'clock in the afternoon. When I opened the file for Claire Hendricks, I noticed something that did not align. Her admission date was listed as February 9th, 1971. Her discharge paperwork indicated she was 34 years old. The discrepancy was obvious enough that I flagged it immediately and requested clarification from the records office. The records supervisor, a woman named Patricia who had worked there for 23 years, told me that the file had been digitized from paper archives several years earlier, and that scanning errors sometimes produced incorrect dates. She seemed unconcerned. She offered to check the original paper file if I needed it, but her tone suggested this was unnecessary. I asked her to retrieve it anyway. The interview with Claire took place in the evaluation room on the 2nd floor. She was a thin woman with gray hair pulled back in a braid. She was alert and responsive. She answered all questions appropriately and demonstrated full orientation to time and place. She knew the current date, the name of the hospital, and the reason she was being evaluated. Her speech was clear and her effect was appropriate. There were no obvious signs of delusion or confusion. Near the end of the evaluation, I asked her to confirm her date of birth. She gave me a month and day, and then provided a year that would make her 76 years old, not 34. I noted this and asked her to repeat it. She gave the same answer. I told her I would need to verify some information before completing the discharge paperwork, and I ended the evaluation. She nodded and said nothing further. I consulted with the attending psychiatrist, Dr. Reeves, who had overseen her care. When I mentioned the age discrepancy, his expression changed. He became visibly uncomfortable. He looked at the file for only a few seconds before closing it and suggesting that I approve the discharge without further documentation. He stated that Claire had been here long enough and that the discharge was appropriate. His language was clipped and final. I asked him about the date of birth discrepancy. He did not answer directly. He said the file had inconsistencies and that they should not delay her release. I returned to the patient unit to complete the paperwork and conduct the final confirmation interview. The floor nurse, a man named Torres, was at the station. I asked him to bring Claire from her room. He stood and walked toward the patient corridor, and I followed. He stopped at a door marked with her name and knocked. There was no answer. He opened the door. The room was empty. The bed was made. The chair by the window, where Torres said she had been sitting moments before, was unoccupied. The window was locked from the inside. I asked Torres when he had last seen her. He said she had been in that chair not more than 10 minutes ago. He said he had walked past the room and seen her there. I asked if she could have left the unit. He said no. The unit doors were locked. Security would have logged any movement. I asked him to check with security anyway. Security confirmed that no one had passed the locked unit doors in the past 2 hours. I returned to the records office and asked Patricia to retrieve the original paper file from the archive room. She was hesitant but complied. The file was old and the pages were yellowed. The intake photographs were in black and white. They showed a woman who was identical in appearance to the patient I had interviewed that morning. The photographs were dated February 9th, 1971. The woman in the photographs looked exactly as she had looked in my evaluation room that afternoon. I brought this to the attention of the hospital administrator, Dr. Marsh. I showed him the digitized file, the discharge paperwork, the original archive file, and the photographs. I explained the age discrepancy and the fact that the patient was no longer in her room. I asked for clarification on how this was possible. Dr. Marsh reviewed the materials without speaking. When he finished, he instructed me to complete the discharge authorization, mark the file as closed, and submit no further reports regarding discrepancies in patient records. He said that Claire Hendricks' case was complex and that the hospital had its own procedures for handling such situations. He said my role was to process the discharge, not to investigate the file. He said the discharge was approved. I signed the release form that evening. Claire Hendricks was marked as discharged on September 23rd. Her file was transferred to a restricted archive accessible only by administrative override. I was reassigned to a facility 3 counties away the following week. Claire Hendricks was never located. No follow-up contact was attempted. Her file was closed and archived on October 1st, 2024. The matter is officially concluded. Story number 2, parole hearing. I arrived at the secure testimony facility on a Tuesday morning in late March. The drive from the field office took 40 minutes through traffic that was heavier than expected. I had prepared witness depositions before, but this assignment carried additional restrictions. The witness was a former senior accountant for a construction firm implicated in a federal racketeering investigation. He had agreed to testify in exchange for immunity, and his safety was considered a priority concern. The facility itself was standard for this type of work, a converted office building in Arlington with reinforced doors, limited visitor access, and a secure conference room on the 3rd floor. The witness had been in protective custody for 6 weeks without incident. His name was Marcus Hollis. He was 54 years old, cooperative, and his demeanor suggested he understood the seriousness of his position. Our first 2 preparation sessions went as expected. I walked him through the likely questions he would face during grand jury testimony. I explained the format, the pace, the importance of precise language. He took notes. He asked clarifying questions about procedure. On the second day, he seemed more relaxed. I thought the preparation was progressing normally. During our 3rd session on Thursday afternoon, something occurred that I did not initially understand. We were discussing the timeline of financial transfers in 2019. Hollis was explaining the structure of the accounts when he stopped mid-sentence and looked at me directly. "Why did you change the question?" he asked. I had not asked a new question. I had been listening to his response. I told him I had not changed anything. "You just asked me about the offshore accounts," he said. "But you asked it differently than before." I had not asked about offshore accounts. I had not spoken for nearly 2 minutes while he was talking. I made a note of this and continued the session, but the moment stayed with me. That evening, I requested the session recording from the facility's technical staff. I wanted to verify what had occurred. The audio technician, a man named Reeves, provided the file without comment. I listened to the entire session in my temporary office. The recording showed my voice, asking questions I had not asked. The questions were professional and relevant, but they were not in my notes. They were not in my handwriting. The sequence of my questions did not match the order of my prepared outline. When I listened to the exact moment Hollis had mentioned the offshore accounts, I heard myself asking about them, but I had no memory of asking that question. The timestamp on the recording was accurate. The voice was unmistakably mine. I brought the recording to Reeves and asked if there was any possibility of tampering or malfunction. He reviewed the file metadata, checked the recording equipment, and inspected the physical setup of the conference room. Everything was functioning properly. There was no evidence of external interference or equipment failure. He said the recording was clean. I filed a preliminary report with the supervising marshal, Agent Patricia Voss. She instructed me to continue the preparation sessions and submit hourly reports documenting any further irregularities. She did not seem surprised by what I had reported. She simply said to maintain protocol and observe. On Friday, the second day of continued sessions, Hollis began answering questions before I asked them, not vaguely or approximately. He would respond to specific questions with precise answers, sometimes beginning his response several seconds before I had finished formulating the question aloud. When I asked about the transfer of funds in March, he provided details about a specific account number and wire routing code that I had not yet asked about. When I asked about the identity of the intermediary, he gave me a name and a date of contact before I had finished my sentence. I asked him if he was reading from notes. He was not. I asked if he had been briefed on these topics by someone else. He said he had not. He said he did not know how he knew the answers. He said the information was simply there when I began to ask. Over the next 2 days, the pattern intensified. Hollis provided testimony that was detailed, specific, and accurate regarding matters we had not yet discussed. He recited conversations between individuals that had not been mentioned in our preparation. He described financial transactions with dates and amounts that matched no documents I had reviewed. His responses grew longer and more elaborate. His manner became increasingly anxious. On Monday, 4 days after the first incident, Hollis recited verbatim testimony that matched the sealed grand jury questions. The questions had not been provided to our office. They would not be delivered until the following week. Yet Hollis recited them exactly, with precise wording, and provided answers that appeared to be complete and accurate. I suspended the preparation sessions immediately. I filed an incident report recommending psychiatric evaluation and a complete timeline verification of all custody logs and facility access records. I noted that the witnesses' responses suggested knowledge of classified materials and questioned whether the facility's security protocols had been compromised. Agent Voss called me that afternoon. She instructed me to cease all documentation related to the sessions. She said the case was being reassigned to a different jurisdiction. Hollis would be transferred to medical observation, pending further evaluation. My session notes were to be destroyed. I was to submit only an administrative summary of the incident and return to the field office for reassignment. I destroyed the notes on Tuesday morning. I submitted the summary that afternoon. The file was processed and archived the following day. My reassignment came through on Friday. I was transferred to a different division, handling different cases, in a different region. The Hollis case was closed. The facility returned to standard operations. There was no follow-up communication, no request for additional information, No inquiry into what had occurred in that conference room. The incident was officially classified and filed. No further action was required. Story number 3, exit counseling. I was assigned to conduct the mandatory 72-hour psychiatric clearance for inmate Daniel Ferris on a Tuesday morning in November. He was scheduled for release after serving 11 years for aggravated assault. The preparation wing observation suite was standard. White walls, reinforced table, recording equipment mounted in the corner. I had done this evaluation approximately 240 times before. The protocol was established and straightforward. Ferris presented well during the initial session. He was 53 years old, cooperative, appropriate effect. He answered the standard questions about his release plans, his support network, his understanding of reentry conditions. His responses were measured and coherent. When I asked about his housing arrangement, he confirmed he was registered at a halfway house in Portland. When I asked about employment prospects, he mentioned construction work through a pre-release job program. Nothing unusual. Then I asked about his emotional state and any concerns he had about the transition. He paused. He told me he was looking forward to seeing his sister, but he was also concerned about something else. He said a woman had been visiting him. He said she came at night, after count, and they had been having conversations about his release. I checked his visitor log. No approved contacts in the past 6 weeks. I asked him for her name. He gave me a name I did not recognize. I asked how she had been cleared for visitation. He said she signed in as his attorney. His public defender was a man named Robert Chen. I had met Robert Chen. He had not visited Ferris in 8 months. I asked Ferris to describe this woman. He provided specific details. Dark hair. Approximately 40 years old. She wore a gray coat. She had visited him 6 times. She knew details about his case that were not public information. She had told him things about his release that were not in any official documentation. I requested security footage review. The supervisor pulled the recordings from the dates Ferris specified. During those times, Ferris was alone in his cell. The camera showed him clearly. There was no one else present. The footage was clear and unambiguous. I documented this discrepancy in my preliminary report and scheduled a second evaluation session for the following day. During the second session, Ferris became agitated when I suggested the visits were not real. He insisted I check the logbook again. He said her name was there. He said she signed in as his attorney. I told him I had already checked. The logbook showed no such entry. He became more insistent. He said she had been there. He said she had explained everything to him. He said he knew what was happening. I consulted with the wing supervisor, Marcus Webb. Webb had been working corrections for 22 years. I told him about the discrepancy. Webb agreed to place Ferris under continuous observation. Webb said he would assign officers to watch the cell during night hours. That night, 3 separate officers reported seeing Ferris speaking to someone. Officer Reeves reported that Ferris was facing the corner of his cell and speaking in a low voice. Officer Dalton reported the same thing approximately 2 hours later. Officer Hinton reported it again at 4 in the morning. All 3 officers said Ferris appeared to be having a conversation. All 3 officers said the cell appeared empty on the camera feed. I reviewed the footage myself. The camera showed Ferris alone. His mouth was moving. His body language suggested he was listening to someone. There was no one there. The following morning, I conducted the 3rd evaluation session. Ferris was calm. His agitation had completely resolved. He was cooperative and coherent. I asked him about the night observations. He said the woman had come again. He said she had explained that everything was arranged. He said he would be going home with her instead of to the halfway house. I asked him what he meant by that. He did not answer. I recommended a psychiatric hold and a delay in his release date. I documented concerns about possible delusional ideation and the need for further psychiatric evaluation. I submitted the recommendation to the facility psychiatrist, Dr. Raymond Okafor, and copied the wing supervisor. The recommendation was being processed. I was preparing additional documentation when I was called to the evaluation room. Ferris had become unresponsive. Medical staff was already present. He was conscious but unable to speak. His right side appeared to be affected. His eyes were moving, but he was not responding to verbal stimuli. The medical assessment was a stroke. Severe. He was transported to the external hospital in Springfield. I completed the incident report noting that the evaluation was incomplete due to medical emergency. Ferris remained in a coma for 9 days. His sister was contacted. She authorized no extraordinary measures. He expired on a Friday. The death certificate listed natural causes. No autopsy was performed per family request. I completed my final report. I listed the evaluation status as incomplete. I noted the medical emergency. I submitted it through standard channels. 2 weeks later, I was called to a meeting with the facility director and a representative from the state office. The representative did not introduce himself. He told me that the Ferris case file had been reclassified under administrative seal. He told me that all documentation related to Ferris's final evaluation period was now restricted. He told me that I was not permitted to discuss the case with any other staff member. He told me I was not permitted to include any reference to it in future reports. 6 weeks later, I received notification that I was being reassigned to a different facility, effective immediately. The notification did not provide a reason. I was transferred to a facility in eastern Oregon, approximately 240 miles away. The Ferris file is sealed. My involvement in the case has been archived. I have not been contacted regarding the matter since my reassignment.